Yes, today we're going to talk about the preventing and reversing the negative psychological like online gaming addiction, and we will delve into this through the concept, the emergence, the symptoms, and maybe the criteria used to diagnose the addiction and the treatment in this related field.
So kindly introduce our honor speaker today, Dr. Edward.
Yes. Our speaker for the webinar today is Dr. Edward Chen. Hi, Doctor.
Hi.
He had a PhD degree in psychology, a Master of Science degree in learning, a Master's degree in nutritional medicine, and a Bachelor in Science with honors degree in psychology. And he's a board certified child and educational board certified couple and the fellow of the Malaysian Association for Psychotherapists and board member of the International Society for Psychotherapy. And also he's a fellow of the World Council for Psychotherapists. He's passionate in spreading professional knowledge to a wider audience. So he's the invited speaker by the Ministry of Women and Social Unity, and invited speaker for the 9th World Congress for Psychotherapy, keynote speaker for the International Psychotherapy, Counselling and Psychiatry Conference, and the invited speaker for the 37th European Psychiatry Conference. And he's also a well-renowned scholar with many published work. He's the author of the Love May Not Be Enough, and the co-author of the Handbook of the Current Research and Practices on Cognitive Behavior Therapy in Asia, and published in the Journal for Reattached Therapy and Experimental Diversities in the Journal Cognitive Theory and Research in the International Journal of Psychiatry. And he's also an accredited reattached therapist and accredited arm clinic therapist. Okay.
Hi, can you hear me?
Yes, we can.
Fantastic. Okay. If you don't hear me clearly, I'll change to a better earphone. And Yuan Yinzuan, yes?
Yes.
You are doing a professional certification course at IPC?
Yes, I am in your art therapist course.
Fantastic. Yes, of course, art therapy and today's topic on gaming addiction are very much related, and maybe we can explore the relationship later.
Yes.
So today we will be talking about gaming addiction, which is a common form of addiction that has plagued quite a few percent of children and adolescents, but also adults. All right, I might add, and we're going to talk about certain population which are more vulnerable to this form of addiction. There are gender differences, and there are personality. There are certain personalities that are more vulnerable as well, right? So we would explore why. We would explore the underlying reasons and why this form of addiction is more prevalent today compared to. I mean, of course, we have internet and all that, So we have more access to these stimulus, of course, compared to a few decades ago. So we would address some of these issues, and of course the problem, the psychological, physical impacts, academic, social impact, relationship impacts on all these, but more importantly, how to reverse and prevent these impacts, right? So this will be in the agenda today, and of course, you can be welcome to also add on your own agenda, and maybe we'll have some questions from others about what they would like to discuss, as this is very much interactional session with those that are interested in this topic, and of course we will post this. I mean, we have decided to host this topic because we have been getting a lot of patients, on this problem, not only adolescents and children, but also adults, right? Partners, the wife, ask the husband to come, or even the adults themselves. I must say, more often men than women, coming with this problem, and we need to, and there are good reasons why it affects men and boys more than girls, right? And we will talk about this. So where do you want to start? What is your preferred name? Is it Yin's one, or so? I don't want to assume.
Claire. Claire.
Claire. All right, that is easy. For some reason, I have more problem remembering Chinese name, although I'm Chinese myself. Probably because I was in England for many years. my brain have forgotten the wiring of all the Chinese names. But Claire is easy. Yeah. All right, Claire. Yes. So how do you want to start this?
I want to start with the concept of this gaming addiction. Like when we talk about it, we usually mention the excessive, the compulsive action, and like whether this excessive compulsive online gaming can be called an addiction.
Yes, so that is a very good point to start. One of the other board certification I have been privileged, to be certified is in addiction, right? I'm a certified substance abuse counselor, but also the addiction therapist, right? So how do we diagnose, right, whether this gaming behavior is an addiction or not, right? So what constitutes an addiction, right? So there are a few behavior and symptoms, right? One is the behavior is beyond your control, right? Despite the negative impact. So your grades start to suffer, your work start to suffer, your relationships start to suffer, but you can't cut it, you can't stop, you can't lessen the behavior. So it's the same with alcohol and drugs, no difference. You lost control, of your behavior to the addiction object, in this case gaming, as opposed to drugs or cigarettes, right? So that is something in common, and of course, secondly, which is very much related to that, your the functional behavior suffer, right? So your work, your studies, even your relationship, start to go downhill compared to before, right? And the behavior, of course, have to be for a certain amount of time. You need to check the DSM-5. I think for, maybe Janet can inform us, but it will be at least for 6 months probably, or for it cannot be just a few days, right? So it will not be long enough for us to give a diagnosis. And thirdly, if you stop the behavior, then you start to have a withdrawal symptom. All right. So just like with drugs, right, heroin or the marijuana, very soon you are not doing it for the pleasure. You are doing it to escape the negative impact, the withdrawal symptoms, the irritation, the displeasure, the depression, the anxiety of not doing it, right? So it become a behavior to stop feeling bad, right? So that's the other aspect. So you would have withdrawal symptom, and later we can talk a little bit about the physical aspects, right? So there is a physical aspect, something in common between drug addiction and gaming addiction, right? Which is a part of the brain, the neurotransmitters, dopamine, right? So this warrants some discussion as well later. So yes, so there are a set of criteria for us to make a diagnosis and assessment that there is indeed a gaming addiction, not just your kids is playing, it's enjoying playing game, right? So that there is a significant difference on that. Good point for us to start, right? So if you see some of these red flags, then bring your child or your husband, to a psychologist to get a proper assessment and see whether an addiction. So addiction is we have a diagnosis book, right? That the psychologists and psychiatrists use, called the DSM-5, and maybe Janet or Visa can show the book, right? So now we are on the 5th version, the DSM-5, but on the earlier version, I think DSM-3, we don't have addiction in it. All right. So that's interesting in itself. Why was addiction added? What do you think, Claire? Why do you think that psychologists, therapists, they decided to? I mean, now let me rephrase the question. What is the impact, right, of adding addiction to the DSM when the earlier DSM?
I didn't hear clearly. Can you repeat the question?
Yeah, I think maybe I should change the earphone. You hold on. I think I will use my Bluetooth, which will fry my brain a bit, but I will sacrifice it for the sake of this webinar. I don't like to use this, right? Okay, so you can hear me better now?
Yes, better.
Yes. Yeah, so the question is what is the impact of having addiction added to the DSM, right? At the DSM-5, I think in DSM-3, you don't have addiction as a diagnosable disorder. So my question is, what do you think is the impact, of having addiction being added on as a diagnosable disorder? Any idea? Or maybe Janet can also.
Why there is an impact? What diagnosis disorder?
No, what is the impact of adding addiction to the DSM-5 or the DSM-4 even? What is the impact?
I need to think.
Well, let me tell you that the impact is that we are considering addiction as a disease. So before that, maybe in DSM-3 you cannot find, because our view of addiction changed, right? Before it was put in the DSM, earlier it was not in the DSM because we don't think addiction is a disease. If your boy play too much game, we think, because he is ill-disciplined, he is he is just indisciplined, right? He's weak will. Same thing the way that we regard people who are on drugs, right? And And unfortunately, in Malaysia, we still do a lot. We use a punitive way of treatment, right? We punish them because we think they have behave badly, right? But when you think it's a disease, we don't punish people who have cancer or people who have depression or people who have diabetes, right? We don't think it's their fault. I mean, even though to some extent, yeah, if you have diabetes and then it's a lifestyle disease, but nevertheless, in general, we don't punish. We don't think that it's the fault of the patient to have this disease. So this is the impact, right? To view addiction as a disorder, a psychological disorder, as a disease, so that we think it is not entirely the fault of the child or the adult. We don't think it's entirely the responsibility of the patients, right? So that is the big impact on the change of view professionals have in regarding addiction, the same as gaming addiction, right? So that is an interesting shift in our view that we have seen over the years, right? So what does that mean for therapy? Big impact for therapy. That means we don't just think it's all on the responsibility of the patient. Of course, we need to show how we can help the patient, right? But the point is they need help.
Yes.
Right? The patient needs help. That they cannot just strengthen their will and overcome this problem, right? So that's the whole point, of this webinar. In fact, that these children, even these adults, they need help to overcome the addiction, the gaming addiction. Left on their own device, they might not be able to do it, right? So that is the meaning of why it is in the DSM. So has the DSM been located, Janet, or they're still finding it?
Yes, I like it when you talk about we don't punish those who have this problem. Is this the emergence of this online gaming addiction sometimes have a deep-rooted social problems, right? Especially maybe the children have some experience some school bullying and they want to escape the reality.
Exactly. So this is what I would term as the pull and push effect of addiction, of gaming addiction. So what you described, right? There are some underlying problem like being bullied, right? So can you elaborate how would say a child being bullied would lead to gaming addiction?
I think when a child being bullied in reality, he tends to be lonely and depressed, and he's finding a place that's safer and non-threatening and has a social network, and even when it's virtual, it's not real, but it's still a network, right? It becomes a shelter for him. And when then try to cut down gaming, they may relapse due to little experience in reality, in social scenarios. So it's very hard for them to give up. Am I right? This is why they become
yes
addicted.
You are right there. I would agree. So the gaming addiction. So not only is it like individual gaming, but nowadays we also have a network of social gaming. You hook up with some of the other gamers. You have a competition. You might not actually know them apart from in this gaming network. So that there is safety there, a safe space, right? Either they do it themselves or in a network. So Janet, you might want to show the vulnerability to harm schema, right? So all of us, children or even adults, have psychological program called schema that were installed, due to certain events, especially when we were younger, like being bullied, right? Being bullied would cause a schema called vulnerability to harm. You want to read a little bit what this is. This is a nice, friendly card, for those of you who are like therapists, you can use it to illustrate with your parents, with your patients, right, with your children. You want to read a few words about what this schema is, Janet?
So this schema is about an exaggerated fear of an imminent catastrophe that one cannot prevent. So fear might revolve around, like, maybe you think you have heart attack or cancer, or the emotional one, you think you are going crazy, or external one, you think that the earthquake will happen, or suddenly you're walking and the bridge will collapse. So you feel like something bad is going to happen soon to you.
Yes, so indeed we have a lot of children that come to see us because of school anxiety, say, right? That they might have been bullied. So they have this exaggerated fear if they go back to school, especially like after COVID, after starting from home, they need to go back to school. So this leads to something called re-entry anxiety, right? That they need to go back to like socialize again physically with their peers, and they would have this fear that they might get bullied, people might not want to be friends with them, right? So we will have, isn't it, January recently, some of these issues of teenagers coming to us. So that would be because of this schema of vulnerability to harm, right? They feel that they are highly vulnerable to being harmed, maybe socially by other students, right? So then they seek out this behavior of gaming, which would be the self-soothing avoidance mode, right? So we have schema and we have coping mode, the way we cope with this mode, which is self-soothing avoidance. Can you read out a little bit what this is about, Janet?
So detached self-mode mode is they use repetitive, addictive, compulsive, and self-stimulating behavior to calm and smooth themselves, or some exciting sensation to distance themselves from harmful feeling. So they may like shop or eat, gambler, self-harm, use drugs or alcohol, or have sex to escape painful feelings.
Exactly. So this is self-soothing behavior to avoid painful feelings, emotional pain, right? So this is the mode, right? The behavioral mode that a gaming addiction might be classified as. So we need to understand how this behavior is formulated, if indeed it is a gaming addiction. If we're not saying all gaming is a gaming addiction, it is possible to enjoy gaming, but it's highly addictive. So maybe later we can talk a little bit about how to have healthy gaming, right? So we don't want to give the impression all gaming is unhealthy and addictive. Just like eating, right? You can be addictive eating, but that doesn't mean that you don't eat, right? So you can have healthy eating as well, right? So we must bear that in mind, right? But we need to talk about why gaming is so addictive. So that there is something about gaming itself just like sugar in food is highly addictive, right? Ice cream is highly addictive. So how do we manage, right, this gaming behavior? So we need to talk about that. So your point, yes, that there are certain underlying causes from bullying to even issues at home, right? Over controlling parents, parents that are not able to give nurturing, right? So a child have several needs, right? One is emotional nurturing, for example, right? So parents might be busy, or they have the, you know, they didn't have the model from their own parents on how to allow their children to be loved in a very unconditional way, for example, right? So the child then might feel the pain, right, of being detached from their parents, you know, that they get scolding all the time, you know, and when they get scolding, that they hear that, you know, you are not loved. So you know, we don't want to blame the parents, but unfortunately, there are different parenting styles that some of them might not be the most healthy, right? So as a result, the child might not get some of these needs, these emotional needs met, and then they might then be pushed towards using gaming as a safe space to avoid, right, the pain or not having these emotional needs met, right? So gaming addiction, just like other form of addiction, might just be the presenting symptom on top, right? Just like your car, you know, the needle is going to the red for the temperature. It's just a presenting symptom, you know. It's not going to solve the problem by just cutting the wire, you know. Your wire will go back to the blue, but your car is still overheated. So the underlying problem is still there. So we need to understand what is the underlying problem behind this gaming addiction, right? So that is the push factor. But there's also a pull factor, right? Because just like sugar is highly addictive, cigarette, nicotine is highly addictive, heroin is highly addictive, right? So if your child go and experiment with smoking cigarette, you know, or even pornography. I think we had a recent talk on that. So all these are highly addictive because it will spike your dopamine, right? So I think it's time that we talk about what is in common with addiction. Is it increases a chemical in our brain called neurotransmitter, basically dopamine. Dopamine gives us pleasure, right? So when you play a game with a rewards, you know, these gamers, programmer are of course very well trained, right? They're trained on how to make the game interesting, stimulating, and of course addictive, right? It goes into giving you instant reward, instant recognition, which your parents do not give you. You do something good, the parents, you know, do not even notice, right? Where's this game say, well done, congratulations, you know, you want a more competence to go to the next level. So this is highly motivating. It spikes your dopamine, right? Just as sugar does and everything. But then the nature of dopamine is that it needs more and more. You know, after a while, just going to this level is not enough. So the dopamine don't get spiked anymore, right? So you need to win more. You need to have a more difficult challenge, which of course the gamer, the programmer would know how to do that, right? To make it more and more challenging. So you go through more obstacles and you get then more dopamine spike again. So before you know it, you spend the whole day doing the gaming to overcome all these difficult challenges to get more and more reward, right? So this is the pull, right? So there's the push and the pull element. So the push is from all the trauma you are experiencing, all your needs not met. and then you are pulled in from the lure of the dopamine stimulation in this gaming industry, right? So that is why, and it is a very attractive space, especially not only for those experiencing bullying. And my question to you, what say talking about children or even adults, what sort of children would experience more bullying? Do you think have a higher percentage of experiencing bullying? Any idea?
You mean whether children have like more children than adults, or
the question is, what type of children would experience more bullying?
what type of children?
Yes.
I think more reserved, like introvert.
Exactly, you're right. So more introverted children, right? So extroverted children might think there's something wrong with them. Why don't they talk, then they get bullied, and of course children with ASD, autistic spectrum disorder, they don't know how to behave. They're a little bit uncomfortable socially. They might have Asperger's syndrome. And Janet can share the book on Asperger's syndrome, right? So this is the diagnosable. Why it was diagnosable in DSM-4 and it's taken out. So this is lumped as ASD, autistic spectrum disorder. Thank you, Janet. Right. So these of children, they're of course more male than females, but female also have Asperger's syndrome. Right. We have a book called Asperger. Maybe you can find it. So these sort of children and even adults, right, if they don't get treated, they find it very awkward in social situations. So of course they have a higher chance of being bullied to start with. But whether they are bullied or not, they find it very stressful in groups, in social situation. So when they do gaming, they're in heaven, right? So they are in environments that they do well. First of all, because it is technology based. So Asperger's syndrome, ASD, these children and people with high SQ. SQ means system quotient, right? So gaming is a type of system, right? You need to know the gaming environment. There are very little emotion there. It's all about logic, overcome the odds, right? So it require system quotient, and Asperger's, people with ASD would excel in it, right? So there's something they're good at, right? They feel safe. So that pull them in and further help them to avoid all the stress in their social situation, in school, in work, right? So what we have now is what we call the perfect storm for gaming addiction, right? Which was not there a decade ago, right? We don't have all the, I remember when I was young, I have very basic game, you just move your your man block from the Space Invader, very basic, right? But still fun, right? So and you need to go to the arcade to do it. You don't have it on the internet. So it's not as accessible to us, but now it is accessible on your phone. So now, with these people with this personality and this stress, then and with this technology available, it really is the perfect storm for gaming addiction, right? So for good or bad, we have everything coming together, and I'm sure gaming is here to stay, so there are pushback from those in the gaming industry, and they say, there's not enough evidence to say, right, it is an addiction. So there are definite pushback. You don't want a multi-billion-dollar industry to be pathologized and jeopardized, right? Just like the porn industry, right? Would not want to say I know pornography is you know, the problem of the porn industry, right? It is a personal choice, your responsibility. Well, we are not here to discuss the politics of gaming addiction, but just to specify that that there are you know, what can be causing it, you know, personalities, schemas, you know, the psychological environments. You know, not everyone can, of course, be addicted, right? So not everyone can be addicted to drinking. You know, same thing. We don't make drinking illegal just because they are alcoholics, right? There. So I don't think we will be making the gaming industry illegal anytime soon, right? So gaming is here to stay, and we need to understand what are the steps we need to take to be able to give therapy to these people who have been addicted, and how to prevent this addiction from taking place, right? So this is what the next segment will be more about. So before we move there, any reflections from you guys?
Any comments or questions?
Oh, good. Yes.
How
Claire.
do we measure the effectiveness? How do we measure this? Like how many hours we spent on the?
Well, yeah, I mean, severity, right? How the many hours would be one way of course, you know, how much time you spend. You know, you want to lead a balanced life, right? You know, of course, it depends on whether you are a child or an adult, whether you're single. I mean, if you're single, then we need to ask, why are you single? I mean, if you are like you know, like an adult, which would be in your prime for a relationship, right? But then you rather, you know, stay at home doing gaming rather than going out, you know, socializing. Then that's probably why you are single, right? You relationship don't happen, right, by itself if you're staying at home. So rather than the number of hours, we ask, what are the functional behavior that you are avoiding using gaming? You know, instead of going out playing soccer with your friends, you rather stay at home gaming. Rather than going to your friend's birthday party, you are staying at home gaming, right? So this is an addiction. It's avoidance of even other pleasurable behavior, other pleasurable functional behavior, right? Instead of doing your homework, you are gaming, of course, yes. I mean, of course, that is easy, right? Who wants to do homework? But then you have to think long term. You know, homework will get you your, you know, your next exam and you know, get you into university ultimately. But gaming, you're just going to be you know, 30-year-old, you're still gaming, and you know, without a job, it's not a good prospect, right? So so that is what we need to measure severity with. What functional behavior have been avoided, you know, due to in place of gaming, right? Of course, the more hours you spend on gaming, the more dysfunctional behavior you are avoiding, right? So that is one for the severity. So that would bring very good point about the hours, right? So ways of management by parents, by family, right, is to have game-free you know, evenings, game-free days, right? So so in order to reverse and treat gaming addiction, you cannot just take away you know, the game, you know, all hell would break loose. If you do that, it's just like, you know, you cannot stop sugar from your kids' diet, you know, they will fight you with tooth and claw, just with the game, right? So it's about how to replace it, right? Slowly with you know, with healthy, pleasurable behavior, right? Of course, if you start earlier on prevention, you know, rather than just dumping your kids with game, you know, when you're busy, I know, all parents are busy. But then again, you know, if you so busy, you need to think twice why you're having children in the first place, right? So, but anyway, the children have come. So so you need to really dedicate some quality time for them rather than dumping them, you know, in front of the games and buying them games, you know, because they enjoy games, you know. Soon, you know, there will be the parents instead of you, you know, the game master. So we don't want that, right? So prevention will be easier, better to have a game free, you know, and other games, right? You can have board games, and at least you are involved. The whole family can play. You know, Monopoly. I used to really love, you know, playing Monopoly, and that's healthy, right? You have interaction. You learn about you know, the economy, right? So that is educational and relationship building, right? But not so much when you are just conquering. You know, using guns to destroy monsters or whatnot, right? Maybe there's a space to develop more healthy game. I'm sure that they are in the market. You know, I don't, to be honest, know enough about the different segments of games. You know, maybe there are, and that there should be. You know, if not, that there's a, you know, I think there's a market for healthy gaming, right? For people to develop educational games, you know, collaborative games, you know, since gaming is here to stay, you know, they probably need to look into that. But on the other hand, you know, there's a lot of peer pressure, right? So if all your friends is playing all these highly addictive game and you're not, you know, you're playing all these healthy educational games, then you know, you're going to be wanting, you'll be very curious what they're doing that you're not, sorry. So it's a difficult situation, but you know, but slowly we need to replace, right? So for the therapy, we need to use art, you know, get the child to involve, enjoy drawing, creating, you know, you using different nature as art form, you know, stones and leaves, and make a creation that will help them with their self-esteem. Instead of getting the self-esteem from winning, you know, more the challenging process in the game. So we need a replacement, right, for that. So this is your connection, art therapy and gaming addiction, right? So we were talking just now initially, you know, so there's big connection there in using art, right? And other form of psychotherapy, of course, to treat gaming addiction, right? So there need to be a replacement which would you know, which would be able to stimulate dopamine, but maybe not to the, you know, extent of gaming, but still it would be good enough, right? That there would be a way to motivate, to increase self-esteem, that in fact will be longer lasting, right? More permanent than that's achieved by gaming, right? So we need to look at the underlying cause. So if it's bullying, we need to help the kids, you know, to deal with the bullying, and bullying may not be the underlying cause, all right? What is causing the bullying? Maybe the Asperger's syndrome, right? So we need to then teach the child on social skills, right? On emotional skills, and we might need to do family therapy to get the parents to learn how to validate, and give emotional support to the children, right? So all these are underlying causes of the gaming addiction. Maybe there have been trauma, right? Physical abuse, sex abuse that might have gone on, and we need to look at that to help the child heal, right? Or even the adults heal. So in doing the therapy in reversing the gaming addiction, we need to address all these underlying causes, right? And of course, the other big underlying cause is ADD, right? Attention deficit disorder, which are very common with children and even with adults, right? So we do from time to time in the International Psychology Center. Sorry, I was cut off. Can you hear me?
Yes.
Yes. All right. So we do this this like camp, right? So once we had this emotional intelligence camp, right? And we brought a group of children to nature, right? And but then they found it very difficult to like just be at nature. Because they are so used to the fast-paced games and all these highly stimulating environment of the digital age that getting them to just look at some trees and jungle is it's not something that they are used to, right? So that is the problem, right, of this addiction, right? So some children they have attention deficit disorder, which means they find it difficult to focus and pay attention to things that are not highly stimulating, fast paced, right? But if we don't provide that, environment normally, right? That they're always exposed to high-paced television and a fast-paced game, then they don't have a chance to develop the emotional muscles for attention, to read a book, to use their imagination, to read a novel, right? To draw a piece of art. So they don't have this opportunity to train the emotional muscles if they get given the stimulus of high-paced game all the time, right? So it is also our responsibility as parents, as teachers, to provide the right opportunity, the healthy opportunity to our children, so that they have the opportunity, whether they have ADD or not, right? Especially those with ADD, that will be sucked into video games, because there's reward all the time, fast pace, and that is just suited to the ADD, right? And they don't have the chance to develop the emotional attention, the emotional muscles, which is what they need. So it is unfortunately not helping the ADD, right? It is making it worse if they are subjected to video games for those with ADD, and they will be all the more attracted, all the more addicted, right? If they have ADD. So there are various special needs, psychological disorders, personality disorders, that make one more vulnerable, whether you are a child or an adult, to this form of addiction, of gaming addiction. And of course, one thing we haven't talked much about is the is the harm to a relationship, to a family relationship, parents, they try to talk to a child that's stuck in their video game, even during dinner, they don't talk to you, they don't answer you, right? They go back to the room, and maybe your boyfriend or husband or do that as well, rather than spending time, and enjoying dinner, they're just detached, right? So well, if they're an adult, then that is more difficult. Then for sure, even a teenager, you should consult a therapist, whether a therapist or psychologist to help do a detox, right? So just like drug addiction, you need a detox, you need a digital detox, you need a gaming detox, right? And we can facilitate that detox to, because there will be withdrawal symptoms for sure, right? Anxiety, depression, or sort of withdrawal symptom, would come in common with drug withdrawal symptom, right? So it's no easy matter to treat and reverse gaming addiction, but it can be done, right? So that is the hope and good news, and we need to ensure that people know, this addiction can be treated, can be helped, right? And maybe seeing a gaming addiction counselor or therapist can help. And of course, we have courses in gaming addiction at the International Psychology Center for those who want to help this very increasingly common form of addiction, right? But gaming is here to stay. It's not going away anytime soon. It's $1 billion industry, right? So it's not going to go away. So we need to equip ourselves in ways to minimize, the opportunity of our loved ones, of our friends of your children becoming an addict, and even after they become an addict, how to help them, right, to get back into a good quality, healthy way of life, right? We have a division in International Psychology Center called Free Life, isn't it, Janice? Free life means freedom, right, from any addictive behavior. So we want to have the healthy ability to choose, whether we want to do gaming or you want to go out and have a, to your friend's party, right? To be able to choose freely and not be a slave to gaming, right? Even when there are all this healthy behavior going on, you feel you cannot do it, you don't want to do it, right? Because gaming is more attractive. So that is not a free choice. That is your addictive brain talking to you. So you need to recognize that. Is that your addicted brain making the decision, or your healthy self making the decision, right? And you need to, as a parent, you need to decide that for your children. They are not in an age where they can healthily make that decision for them. Don't just leave them with the new games all the time. Then then for sure you are not giving them that choice. You are subjecting them to something that is that they will not be able to control, right? So they are at the mercy of the very sophisticated, clever programmer instead. So any final reflections or questions?
Okay, I will ask a final question. If we want to dig deeper in this, in the related field, especially under the Malaysian context, like what kind of topics are worthy of researching in this field? If we like,
Right. What are the research opportunity you mean in this field that haven't been still explored? You mean? Is that the
I
question?
mean, like, there are many related topics we can research in, like, in this, but like, what kind of topics are especially worthy to explore under the Malaysian context? Maybe some examples of victims in Malaysia.
So is there any like Malaysian context whereby which is unique in this gaming addiction? Is that your question? Well, I would think, I mean, okay, this is hypothesis. Aisha, are you Muslim? Yes. Okay. So Aisha might be able to give us a perspective, right? We are in a Malaysia in a very familiar with the Muslim culture, right? I think it will be interesting to look at gaming addiction across culture, since we are in a multicultural society, right? My hypothesis would that there might be a higher form of gaming addiction with the Muslim community. That would be my hypothesis, right? But we have to look at research. I don't know whether there were research done on the multicultural comparison, right? And I have some ideas of why that would be the case, right? Because right, there are more like prohibition, maybe, in a Muslim culture. So gaming, I don't think is halal. So it is an activity that can be enjoyed religiously, right? But on the other hand, it is highly addictive. So I would hypothesize that you might see more vulnerability in the Muslim community, but someone should check that out and see whether that might be the case. What do you think, Aisha? Do you feel like there are more gaming addiction with your Muslim colleagues than your non-Muslim colleagues? Do you think it's a big problem in Muslim community?
I don't see it as a big problem. But I do see it happen, like once it happens, like when they've got like a 10-minute break, or when we're waiting for somebody, like it's automatically just whip up on our phones and play with it, but not
right.
Not addicted. Like I play games too, but I found a way to like trick myself to not be so addicted to it. Like I would wait, and if I have like a full like weekend to myself, then I like to finish the game nonstop. So like if I have a full weekend to myself, I will spend the weekend finishing that game until it's finished. And yeah. That's my habit.
Right.
But to answer your question, yeah.
Okay, so that is something to look into. Then thank you, Aisha, for your perspective. But in our clinical experience, we do see quite a number of Muslim patients, with this problem, Muslim men, especially, right? So I don't know whether I'm sure it affects all the cultures and races as well, but that would be worth exploring. whether there's any vulnerable points, like in terms of specific culture of addiction. And I hope that answer your interesting question, Claire.
Thank you.
So, Janet, I think maybe it is time to wrap this up or wrap up.
So thank
You
you,
want
Dr.
to-
Edward
yes.
and Claire, for giving us so many interesting information. And our webinar about gaming addiction will end here. We'll see you next time.